Hello, my name is Dr. Nicolas Small. I'm a GP. I work in Elstree and Bushey in West Hertfordshire, and I am the training hub clinical lead for Hertfordshire and West Essex. So what I'd like to do in this short video is explain to you a little bit about the structure of health services within Hertfordshire and West Essex, how you as somebody working in a practice will relate to that, and then a little bit about some of the exciting things that we hope to be pursuing in the future and the support we want to give you. So firstly, everybody will realise that primary care is centred around practices, GP practices. Of course, out of hours, some urgent care centres and other out of hours providers do provide something which is a primary care focus. Each practice belongs to something called a primary care network. These were introduced just about 3 years ago in a major government reform, and what that means is that a group of practices work very closely together to develop services that address the population health needs of the patch that they serve. And there are some incredible differences across our patch in terms of life expectancy, in terms of levels of asthma, diabetes, children's care, those on at-risk registers. And so every primary care network will have a slightly different focus depending on the needs of their own population. So within a practice, within a primary care network, you'll really be able to make an enormous difference by working together with other colleagues to come up with plans and address those needs. And we only have to look at COVID to realise just how complicated needs can be and how many inequalities there are in the care of our patients, and we want to address those. We know, for example, that those from ethnic minorities had a much lower COVID vaccine uptake rate. And what was really incredible about primary care during the COVID vaccination campaign was the way that primary care networks came together and delivered a really amazing vaccine delivery, getting into those groups of people who were perhaps more vaccine hesitant. So I think that gives us tremendous optimism for the future of working together collaboratively in primary care networks. As well as primary care networks, we also work in our own localities. So they're often centred around district councils because in all of our patch we have what we call two-tier government, and so we have Hertfordshire County Council, Essex County Council, but also many district and town councils. And so the primary care networks have also got a major role to play in working with those to address patient needs. And once again, the vaccine programme and spotting COVID hotspots was a remarkable success in our patch in terms of really working to deliver the best possible care. We also have something called a GP Federation. Many of you may not really have heard of that, but these are groups of practices who work together at scale to deliver some care. And just to give you a few examples of that, In some parts of our patch, they have been delivering out-of-hours care. In other parts, they've been delivering leg ulcer care. And so if you're working in a practice, you may well get to hear about federations. And because they work at large scale, they can do things that perhaps an individual practice wouldn't be able to do. Then we have something called a health and care partnership. Apologies, this is quite complicated. Health and care partnerships are new ways of working, and in each of our 3 geographical areas that I've described, they will deliver care at scale for the populations they serve. What's different about them compared to, say, CCGs in the past is they're really multi-collaborative. They take in all stakeholders, you know, from the acutes to community, to the voluntary care sector, to county council, children and adult care services, etc. And they can really make a difference. And so it may well be that you'll get involved working in one of our practices at that level. And then finally, but by no means least, we all belong to an integrated care system. I am also a partner member of the Herts and West Essex Integrated Care Board, and this will basically hold an enormous budget into the, you know, well into the billions, and will be responsible for the care of the total population. What's, as I said, different about the new system is this collaboration. So we're around the table, we will have senior leaders in mental health, learning disability and autism, those working in the acute hospital sector, those in the community sector, those voluntary community faith and social enterprise sector, and also, by no means least, primary care. This is a really exciting time to be part of Herts and West Essex, and the training hub, which I think you'll hear about a little bit later, is really going to try and deliver to support you, whatever your professional role. So I really want to make it clear that our training hub is not only looking after GPs, but practice nurses, practice managers, physiotherapists, social care support, and other examples are some practices have got a paramedic as part of their team. So the whole way in which we work, and this is exciting, even in a practice, is much more multidisciplinary. That gives people working in it massive opportunities to develop the skills that they want in a way that was just not possible, say, 3 to 5 years ago. So I believe finally this is a wonderful time for us to be working in Herts and West Essex. Our team are so passionate about supporting you, and on our website, which will be explained in other parts of this video, we will help to support you. So once again, thank you for working in Herts and West Essex. We want to hear from you about things that we're doing well and things that we're not doing well. If you want to dip into a little bit more about the whole training team, then on the 3rd Tuesday of every month, we have a webinar between 1 and 2, a bite-sized webinar, and in that you'll certainly hear lots of the things that I've sort of touched on briefly. So great to have you on board, and I really hope that we're going to meet many of you joining us over the next year or so. Thank you.